functional design template that their body is supposed to be in. And that joint and alignment position is dictated by where our tendons and our muscles and all that attach. So if you look at the human body, our shoulders should be level, our hips should be level, our knees should be level, our ankles should be level from the front view. Also, when you're in a standing posture, your feet are your foundation, how you stand. You don't want your legs to be too far apart. You don't want your feet to be too close together because you're creating an imbalance, and your body's not going to work as efficiently in gravity as it should. So when you're looking at somebody from a front posture perspective, you have 4 load joints on each side. So your ankle, your knee, your hip, and then this part of your shoulder should be in one nice straight line. So if you think about your body as a bunch of guide wires, the straighter those guide wires are, and they're not twisted up, the more integrity our body has to be able to be resilient and tolerate certain motions, as well as just daily gravity. From the pelvis, this is called the ASIS, and this is the PSIS. If you take these 2 bony landmarks and draw a line, you should have a little tilt on your belt so that water would want to run off this way. Now, if that tilt is too great, it's going to push me forward in gravity. And so what's going to happen is my upper body is going to want to lean back so I don't fall over. So this is huge spinal compression on the lumbar spine. This is a very common one that people have because they sit in a regular, or they sit on a long-term basis. So the hip flexors don't have to be long, so they shorten up. And then that creates tension pulling the pelvis forward. Also, the head becomes forward, and then they get a kyphosis, or a bigger curvature in the mid-back than what they should, and then their neck is hanging out here, and these muscles are grabbing for dear life, just pulling you back, and so we start getting a lot of mid-back and cervical pain. So from the side posture, your ear should be over your shoulder, over your hip, over your knee, over your ankle. This is your vertical load line. So in that, if that vertical load line is perfect, up and down, you have a shearing force dynamically, even from the front of the body to the back of the body. So therefore, when we're walking, we have less tension on our body. When we're sitting, we have less tension on our body. A fun thing to do is just to check in with yourself. If you don't know, because it's kind of hard to tell sometimes where you're at, is go put your heels against the wall, keep your feet shoulder width apart, put your whole body back against the wall, and it's going to feel really funny for a little bit. And then when you walk away from the wall, that's where your body should be. So with Egoscue, when you come in, we analyze, and a lot of times I take photos and draw lines on you, put in the computer, I have this little stick figure I manipulate to look like you, and we want to start seeing where those postural deviations are, the poor posture is. Going back to like a bicep tendonitis or shoulder issues, rotator cuff, if a lot of times people's hands are here in front of their body, they should be hanging at the side, and you should just see this much of the hand. The reason it's important is because if that is the joint position, then the muscles, as they cross over to their insertion points, aren't going to have stress on it. So if I have my shoulder is rolled here, which is common because most people have weak latissimus dorsis and lower traps, so the shoulder blades want to just kind of fall out to the side, and then we slouch, so we're pushing them. So that's a common thing for these to round. It's not necessarily a tightness here. But if those misalignments occur, and I go to raise my arm, I cannot raise it as far, and all of a sudden I get bursitis, inflammation in there, or all of a sudden I tear a rotator cuff if I go to grab for something. So if the joint position's here and you're asking me to raise my arm, I have full range of motion and it doesn't hurt. If the joint position's here and I go to do that same motion, I can't raise it as far, and I start pinching, creating a lot of inflammation inside that joint space. And after a period of time, it just wears and tears on the connective tissue, and it creates wears and tears over in a sac inside each joint called a bursa. Wears and tears on that. Eventually, we start grinding that down to where there's nothing left in the shoulder. Or we put micro tears into one of these back muscles, or a common one is this top muscle up here, the supraspinatus. So the more those things occur, then again, all of a sudden, you go to throw a ball with your grandson, whatever, and all of a sudden you just hurt your shoulder. So it's been building, going back to building for a long period of time, and then all of a sudden you cannot take it. So in our daily lives, we have good input and we have bad input. So good input is things that you're trying to do to restore. Part of that is recognition. So if you look in the mirror and you're like, oh, I really hate this big hump right here on the back of my neck, and my grandmother's really slouchy, or my father-in-law walked really, rounded over. I don't want to look like that. recognizing those deficiencies or recognizing where things don't look proper and trying to restore those is putting good input. Now it might be a simple door stretch, leaning in the door to help extend that spine and take that out. It might be standing up against the wall, something to restore, to put you back in that design functional template. If you slouch and you sit at a desk all day long, or if you aren't as active, motion is lotion, and so you got to lubricate those tendons and lubricate those joints. But when you stop using it, there's a thing called ground substance in the body. Ground substance is like the lubricating foundation for everything. As you get older, you stop producing it anyway. When you have stress, and stress, i.e. not moving as well as mental stress, then that ground substance starts deteriorating and going bye-bye. And so then all of a sudden you can't stretch as much as you can. You can't touch your toes. And so motion is lotion. We want to keep moving it and putting good input in. So part of the process too is as you become more aware of your body, you start realizing where all the bad input's coming from. I used to have a really high left shoulder and be a little rotated. And I couldn't figure out what was I doing. And every morning I talked to my dad on the phone in the car. And so when you put your phone here, for safety, for driving, you have to put your hand up here, which rotates this forward and here. So 15 minutes every day is just enough to create that pattern. When I had my photo taken from the side view, the lateral vertical load line, I looked like a ski jumper. Literally, the line started back here and got further and further away from my body as it came up to my head. And that's because at work we have massage tables, and when I'm doing acupuncture on people, I'm constantly leaning my thighs into that table. And then all of a sudden it was an aha moment, like after learning about this and doing the good exercises, all of a sudden I'm working with somebody and I'm like, there's my vertical, that's one of my vertical load lines off. So now you have to eliminate that bad input. So now I'm constantly catching myself, or I'll constantly go and stand against a wall for kind of biofeedback to help put me back, in that position. So with Egoscue, you come in, we analyze you, look at where your postural deviations are at and where the imbalances are, and then we design a menu based on what you're capable of doing at the level that you're able to do it, and at the time, because it's going to require input every day. So if somebody comes in and they're like, I'll take an hour of exercises, I can do these every day, I decrease them to about 15. I'd rather start small and have you say, all right, Brian, I can take a couple more. Otherwise, a week or 2 weeks down the road, you're like, yeah, I haven't done it in a while. But when you find that your pain's being relieved by it, then people will continue to do it. And the trick is, it's young people, like I have 12-year-olds that come in to become a better soccer player, or I have a lot of people come in for tennis and sports, and they respond so quick. The younger they are, that memory hasn't locked into their body as much. They don't keep putting the same bad input for such a long period of time, so you're catching it in an earlier age, and that ground substance is so fluid. I mean, I had one kid come in and his butt was that far from the wall, had his legs straight up the wall, and ideally you should be able to touch your butt to the wall, have your legs straight up the wall, and your leg locked out. So it only took him about 2 weeks to get there. It took me about 6 months to get there. The older we get, as arthritis develops and loss of that range of motion, then all of a sudden we can't do certain exercise, so we have to do a lot of modifications. So you might have to stay away from an exercise that puts you down onto your knees. So we modify and we fit it to your schedule, and then basically you walk away with a menu of good input, very specific to restore and correct all the bad input and stuff that's happened to your body over a period of time. So it's kind of like very refined, specific information. A lot of them are yoga-based, some of them are not, to have you put in on a daily basis. Now, again, tying the passive and the active together, and then we'll get rolling here, is that if you get an adjustment, right, but you go and do the exact same posture that's creating stress on your neck and throwing things out, you never do this, and you just come in and you're just like, just pop my back, make it feel better, 4 minutes in and out, which by